More people would be insured, but costs for health insurance could rise, according to a new study of how the federal health care law impacts Wisconsin.
News 3's Jessica Arp tells us what the study says about what you pay for health care and how some groups disagree, Jess.
Well, this report was commissioned last year to study just how the federal health care law would affect people in the state. And the results say while some may gain access to insurance, others could simply pay more. A Massachusetts-based actuarial firm and an MIT economist looked at how the law would shake out in Wisconsin by 2016. That's the final stage of the federal health care reform law. The number of uninsured people is expected to shrink by 65%. But the study estimates some 60% of people without health care through their employer will pay 30% more for insurance. Another 30% will pay higher premiums but get those costs covered by special tax credits.
When we look where the debate of health care reform started, where we were ensured that people would keep their health plan if they liked it, and everyone was going to see lower costs, we know now that the picture is very different.
It's possible that costs could go up for some people, but the cost is going to be to our society of not having those folks insured and uninsured on the street and using the emergency room is far greater for us in our pocketbooks and for us as a society.
Bobby Peterson, Executive Director of Healthcare Advocacy Group ABC for Health, says the study isn't fully credible and says incorrect assumptions are made to get certain results. Now, one big issue there is the federal government hasn't said exactly what the minimum health plan is that people would have to be required to have under the law. That would, of course, affect how what you would pay may go up or down. The state says they will try to take measures moving forward to mitigate any rate increases. They would like to run any health care exchanges rather than having the federal government do it. They say it gives them a little more control on these prices.
Jessica Arp reporting tonight. Jess, thanks.